the studio right now. Ryan Jesperson standing by.
Thanks very much, Wendy. We're joined by Dr. Marlene Detock, and Doctor, we're talking eczema today. Before we get into the specifics, why don't we just kind of get the basics covered here? What is eczema exactly?
Eczema is a layman's term for atopic dermatitis. It's a chronic and relapsing skin condition characterized by inflammation and itch. It is hereditary, and fortunately, most people outgrow it by puberty.
Good news, of course, for those that are going through it. I remember when I was in school, some good friends of mine dealt with eczema. It's sort of a timely moment to talk about it. Now, I guess as the weather's dropping, the air gets a little bit more dry. I would imagine that affects skin condition of kids with
That's correct, Ryan. Dryness drives the eczema, so we really recommend a lot of bathing and moisturizing and making sure that our ambient humidity is good for children and patients with eczema, and that really goes into our ABC of eczema.
Yeah. Well, Doctor, I mean, first of all, why is it so important that we talk about this today? It's one of those things that it's not just a physical condition. It has a greater effect on kids, doesn't it?
That's right. You know, awareness of eczema promotes understanding, and that helps children, especially with eczema, to feel more comfortable, because itching and scratching can lead to poor self-esteem with teasing in school and isolation in children.
Sure. I mean, it seems with kids, anything that sort of sets them apart is a chance for kids to maybe struggle with it a bit, but also a chance for kids to set themselves apart and be able to be confident so long as they have the tools to know how to deal with it.
That's correct. Yes.
I understand not only as a doctor, but you're a parent of a child with eczema as well.
That's right, a first-time mother.
Yeah, really? So your first child, how have you gone about it as a parent, helping your child deal with the condition?
Well, fortunately, my child has mild eczema, and that goes to show that the ABC of eczema works. A, for a daily skin routine of bathing and moisturizing, being patient, giving a lot of care and attention to the child, and talking about it to parents, teachers, and other children. So I think that if we catch the inflammation early as well in our children and apply medications before it becomes weeping and oozing and even infected, then the rewards are great. And just like the joys of motherhood, you know, if you catch things early, you're proactive, then the children are less to suffer.
Great. Well, you know, there's a couple of tools for parents out there as well. Let's take a look here at pennysworld.ca. It's an online web resource that parents can use to not only learn more about eczema themselves, but learn how to communicate with their children. Tell us a bit about this web resource, Doctor.
Well, this web resource, as well as eczemacanada.ca, it provides a lot of brochures and educational materials for patients, children, and families, as well as teachers. They can all participate in the care of patients with eczema.
Why is awareness so important, do you think? I mean, I would imagine that not only is it important for parents with children dealing with eczema to talk to them, but also maybe parents whose kids don't suffer from it at all, to have a greater understanding of maybe different situations or different children with different challenges that they'll encounter maybe at school or on the playground?
Yeah, I think you've hit the key points. Awareness translates to understanding, and if there is more understanding in the public, then children feel more accepted with their skin condition, and also people can help assist patients with eczema. For example, teachers can throw more attention to these children, maybe help with applying medication, and also looking to activities that may or may not be appropriate for these kids.
Well, we know that this is all helpful advice for parents, so if we can sum it up quickly, we would say the ABCs of managing eczema as we get into the cooler temperatures. You were saying humidify, stay clean, wash daily,
and catch inflammation early.
Oh, there we go. Nice and simple. Dr. Marlene Detock, thank you so much for joining us.
Thank you very much.
We've got more breakfast television from here in the studio. For now, we'll go back to Michelle with a look at the BT Traffic Watch.
Thanks very much, Ryan. BT traffic time is 7:45. We've got a great start out there. Obviously, steady volume here. Walterdale Bridge looking good coming into the downtown.